I've been here about 20 years now, and I can tell you that I don't remember the last time I was this excited, with the exception of when one of my kids was discharged from our PICU a few years ago. We've got some really big news to share with you today, and in the spirit of the holidays, we're unveiling them this morning with all of you, and then throughout the Valley with the media. I've invited some special helpers, Brennan and Jasmine. If you would come up here, but hold on just a second. No, come up. But when you come up, don't start the job yet. Come on up. And Brandon and Misha, if you can come up. And I've invited these young people that are very special to us, obviously, and George, who's in his holiday attire, to help unwrap these presents that are here. And in just a minute, I'll tell you more about each one of these. But first, I'd like you guys to give me a hand and go ahead and tear these open, unwrap these, and we might need some help so they don't fall off.
Excuse me. Brandon got it.
Oh, sure. So first, I'd like to introduce you today to Valley Children's Healthcare. We're more than a hospital now. As many of you here know, we have clinic operations and our physicians practicing all over the Valley. We have our owned and operated neonatal intensive care units in Hanford, Merced, and Fresno. And in building upon our past, we're taking steps to reinvest in the communities that we serve, which are really the Valley. And somebody's trying to be reached, apparently. We're reinvesting in the Valley that we have been a part of for over 60 years, and the communities from around the Valley that have invested in us and entrusted the thing that is most precious to them in their life or lives, and that's their children. And so we are enhancing our presence in the Valley, and we'll be investing in Valley Children's Healthcare, which is a network which will encompass our hospital, foundation, our medical foundation, our doctors, clinics, and many of the other offerings I've already mentioned. We want to make sure that we create infrastructure around the Valley that makes it easier for patients and families to reach Valley Children's closer to home. Our vision is that within a few short years, which 3 to 5 years is our vision, that nobody in the Valley will have to travel more than 30 minutes to get to Valley Children's, whether that's a physician's office, one of our partnered offerings, similar to the announcement we had a few weeks ago, the new partnership with Adventist Health in Fowler to create additional access there, but that's just an example and a model of how we will continue to invest through Valley Children's Healthcare in the future. The second part of our announcement today is that we will be returning to our cherished and trusted name of Valley Children's Hospital for the Madera campus. Valley Children's Hospital is our founding name, as you all know, and one that has represented quality and compassionate care for over 60 years. And even those of us that have been here as Children's Hospital Central California, in our hearts, we knew always we were Valley Children's Hospital, and we're returning to that. So wherever you go in the Valley, you'll see Valley Children's Healthcare, you'll see Valley Children's Hospital here in Madera, In Hanford, you'll see Valley Children's Neonatal Intensive Care Unit. That's our owned and operated unit there, in Merced and so on. But our network that we're focusing on and creating this access, I think it's really important to note. And our network is going to focus on creating access, partnering to create access. So families don't have to travel as far. They can get care closer to home. And maybe even, and this is, again, the vision, and we'll be spending some years accomplishing this, maybe even we can get to true wellness, where kids don't ever have to come to the hospital or the main campus. Maybe we can get to them sooner in their care and keep them well closer to home. So a family doesn't have to be disadvantaged, a young person doesn't have to come up here, and we can do a better job of keeping kids healthy. But we need to build this network and continue to build it to accomplish that goal. And to that end, the third part of what I'd like to share with you today is we're thrilled to announce an expanded partnership with Stanford Children's Health. We have, for the last decade, had our pediatric cardiothoracic program that is in partnership with Stanford Children's Health, Drs. McDonald and Petrosian, and we're expanding our relationship with Stanford Children's Health, which is a dedicated pediatric organization. We will come together and leverage our resources together and inform many decisions through Valley Children's Healthcare to innovate new ways of providing care. What do we mean by that? We mean that there is work we can do to make sure that the right resources are brought to bear at the right time in the right place. And so our two organizations coming together in partnership and leveraging our strengths will produce better outcomes for kids and create more access in the decades to come. We think it is a great thing for both organizations, and I'm very much looking forward to the work that our two teams will do together to innovate new care models, to, in fact, do things more efficiently, create economies of scale together, but the focus, again, is the patient, is children. How to keep them well, how to keep them closer to home, how those families can be together just down the street as opposed to coming to the main site, and how together two extraordinary organizations, in my view. I would like to introduce, I should say, where'd she go? Beverly Hayden Pugh, our Senior Vice President of Clinical Operations and also our Chief Nursing Officer. I sometimes refer to her as the Queen of Nursing. She is wearing a regal color today, so I think it fits.
This is just incredibly exciting. I mean, Valley Children's, that connects here, and I think with many in the room. So it's really a wonderful place to be in our organization. I think it's really fitting that we're in the Guild Hall of Fame. As you look around, there were 5 young women represented on that side of the Hall of Fame who were young mothers in their 20s, some teens, 19, who had a vision that they wanted to bring health care close to their kids. 5 women in their 20s. Over 62 years later, we've really kept that as the core of our foundation. As we've gone out into our 45,000 square mile area that we provide services, we've really focused on partnering with the communities and the communities that we serve. So, you know, as we enter this new endeavor for the organization, we really are connecting to our roots. And we're going to build upon the successes that we've had. I mean, I could spend all day talking about the quality outcomes that we have here. We have innovation. We do things like water safety, adaptive sports. In the NICU, our tiniest babies not only survive, but they thrive. And when we bench ourselves against other children's hospitals in the nation, we know we're outstanding. In the PICU, where we have some of the sickest kids in the nation, our survival rates are outstanding. I mean, that's the work and the foundation upon which we're building our Valley Children's Healthcare. And I think it's a wonderful foundation to build upon. We have many awards that reflect the care that's provided here. One that again is near and dear to my heart is our Magnet Nursing Award, which we've gotten 3 times, which reflects not only nursing, but the clinical team that makes a difference every day in the lives of the kids we serve. and look forward to partnering with all of you as well as our communities as we build a new foundation for Valley Children's Healthcare. Thank you.
So for those of you that are staff here and those that are longstanding investors in Valley Children's, all of those t-shirts, sweatshirts, windbreakers, bring them back. Beverly tells me that and Jane tell me that there will be a commemorative day where we all get out our Valley Children's memorabilia. It's back in season. So thank you all very much for coming. Thank you very much.